Hi, this is Dr. Raul Garcia with Miami Designer Smiles. Thank you for spending a few minutes with me talking about such an important topic as snoring and sleep apnea. I think that this is something kind of interesting, a dentist talking about this topic, but there's actually a lot of overlap between our training as physiologic dentists and our patients that have TMJ, headache problems, or head and neck pain, and undersized jaws is really the cause of the snoring and sleep apnea. I always like to have this so you can sort of see that when someone has small jaws, their airway and their neck might be compromised. And so a lot of our TMJ or head and neck pain patients, or people who grind their teeth a lot or clench their teeth, can have some airway issues. I sometimes like to refer patients to this book and say, you know, this book is written by an anthropologist, and he's talking about how our jaws are getting smaller in the last 150 years or so. A combination of things. We're really not getting breastfed like we were supposed to be. Once we started using electricity, we started blending our food and making soft food, but prehistoric man would have would have breastfed and then would have gnawed on food, and it was very important muscular exercise. And for proper development, we need to breathe through our nose, lips closed, and tongue in the palate, and that allows for sufficient development of the head and neck area. But frankly, you know, we as a people, we're really kind of sacrificed because we're also consuming cow's milk, which can change our breathing because it can enlarge our tonsils and adenoids, and also it can, even pollution, the Industrial Revolution has affected modern man. So several things that can cause us insufficient development. And so I think of the tongue like a lion in a cage, and so I just say, you know, if we don't have sufficient development of that cage, then that could be a bit of a problem. And if you look at this illustration here, you know, we have someone, you know, I say if we're awake, we're not going to let that tube collapse. Our brain is not going to allow it. But when we go to sleep and our computer, as I say, is turned off, is the tube staying open or is it reduced? I don't love the word snoring because actually there's a lot of people who don't necessarily make noise, but they can still have reduced airway space. And it's not good for our airway to be reduced. And of course, in people who have actual apneic events or apnea, their jaw is actually slipping back to the point that it gets pinched. I recommend that everyone get a baseline home sleep study at any age. Frankly, if your child is tossing, turning, is having any issues with bedwetting, is having any issues with attention, before any child gets diagnosed with ADD or any kind of attention disorder, I think that they should be tested for sleep apnea, because if you don't sleep properly, your behavior won't be so good the next day. So this can affect children, it can affect adults. Men is kind of a lifelong problem. Men, we can be affected at any age, and I would say a high percentage of men actually have some kind of snoring or sleep apnea. Women, not that they can't have it, but they tend to be more protected before menopause, but after menopause, they tend to worsen. The estrogen can be quite protective, but after menopause, they can also worsen. So I think it's something important that everyone should get screened for. Of course, patients have options on how they get treated. Someone who gets treated with that, they could use a CPAP, continuous positive airway pressure, is a mask as it's typically called, with a machine that blows positive pressure. What I see from my point of view as a dentist that treats sleep apnea is that only about maybe 40-50% of people who get recommended as CPAP actually will use it, and so the rest won't use it. And the other problem is, even people who use it, sometimes they have terrible parafunctional habits, that they're grinding, clenching, or biting down in a way that's pathologic and wearing down their teeth. So I sometimes call it combination therapy, where they're using a mouth appliance along with their CPAP, or someone who cannot tolerate a CPAP should definitely consider a mouth appliance. So this is quite simple, and it's elegant in its simplicity. This is our top jaw and lower jaw, and when we go to sleep, one of the issues is that the muscles which have the lower jaw like on a sling, if our tongue and our lower jaw is slacking back, Then these appliances are called MAD, mandibular advancement devices, and they're quite simple. They go one on the top and one on the bottom. And these appliances, although they look like they're bulky, they actually are adding tongue space because they're lingualists. They're not really stealing any of the space here. And when a person goes to sleep, these little wings are going to help the patient's jaw hold in a certain position. When we look at the appliance from the front, there's actually an extra 3 to 4 millimeters of space between the teeth, which creates a volume of additional space for the tongue. I would say that in my experience, I find that 90% of people who get into a mandibular advancement device, or sleep appliance as we commonly call it, are able to accept it. They come with a sequence of numbers, so they're actually adjustable. We do home sleep testing that gets read by a medical doctor, and we do follow-up sleep studies to ensure that the patient is having a successful result with their mouth appliance. And so I just wanted to create some awareness that there's alternatives to a CPAP, and that that's not the only way to go. This is also great for travel and airplanes and many other times where it's not convenient to be on a CPAP machine. I think every person should have some kind of baseline sleep study. If they have any symptoms, then earlier better than later. But usually by the age of 25, we should be having our first sleep study to kind of start regulating our baseline numbers. Sleep studies are quite interesting. They're a peephole into our future health issues. Sleep apnea can lead to high blood pressure, gastric reflux. It can also lead to diabetes if there's a family history of diabetes. And of course, quality of life. Sometimes someone could die from sleep apnea, although that is not the most common thing. I think of it more like they're aging poorly, but someone could die from sleep apnea in an apneic event. Sometimes I think we romanticize the idea of someone passing away in their sleep as if that was a peaceful sleep. I think of it kind of like a choking sleep for the most part if they die from sleep apnea. But nevertheless, I think our loved ones, if you're sleeping next to someone who has snoring issues, I want you to think of that like if your air conditioner was making noise and you would be calling the AC person because you don't think that noise is normal. So snoring has become so common that people think it's normal, but it's not normal, and we should not be making all these noises while we're sleeping. Sleep better sitting up, or you use multiple pillows behind your head. Those should all be clues that you have an airway problem, because it is normal to sleep with only one pillow behind your head. But anyways, I have really enjoyed spending a little time kind of explaining some of the things that we see from our experience as physiologic dentists, treating patients with head and neck issues, including snoring and sleep apnea. And my wish is that more people get educated about it and they get some treatment for themselves or their loved ones. And so again, this is Dr. Raul Garcia with Miami Designer Smiles. I hope you'll consider following us on Instagram, on Facebook, or checking out our website, www.miamidesignersmiles.com.